Have you ever grappled with one of those truly persistent, sort of head-scratching problems, the kind that just keeps cropping up,
hmm
even where you thought you'd nailed it? Maybe it's, I don't know, a slow leak under the sink or that computer glitch that just won't quit?
Right. Infuriating.
Exactly. Well, for horse owners, that frustration often looks like chronic and recurrent colic. It's not just a one-off bad day, it's this really perplexing issue.
Yeah. It demands a lot of patience, definitely some detective work, and a really systematic way of thinking about it.
Totally different from just a single acute episode.
Absolutely. And that's really our mission with this deep dive. We've gathered a whole stack of sources, research papers, vet articles, you name it.
Okay.
And we're going to distill it all down for you, get you the most important insights, the key knowledge.
Like a shortcut.
Exactly. A shortcut to getting well informed on this pretty challenging equine condition. We've got some surprising facts, some really practical takeaways you might not just stumble across easily.
Okay, let's unpack this right from the get-go then. We talk about chronic versus recurrent colic.
hmm
When an owner calls saying, my horse has colic again, how do vets start thinking about that difference? Especially when the signs might look, well, pretty similar sometimes.
That's a really crucial distinction, yeah.
Yeah.
It basically guides the whole diagnostic path. They do overlap quite a bit, but generally we define recurrent colic as, say, 3 or more distinct episodes.
Okay, separate times.
Right. They resolve, but then they come back. It's a pattern of these specific events.
Got it.
Chronic colic, though, is a bit different. It's more of a persistent, maybe low-grade abdominal discomfort. It might not even look like a typical colic attack.
So more subtle signs.
Exactly.
Yeah.
Things like poor performance that you can't explain, weight loss that just creeps on, maybe even noticeable changes in behavior. Grumpy, perhaps.
Mm.
And what's really important to get is that a lot of these recurrent cases, they actually have a chronic issue underneath. That low-grade problem just flares up now and then into the colic you actually see.
Ah, okay, that makes sense.
And it's not always the gut either. Chronic abdominal pain can come from other places, the liver, spleen, kidneys, uterus,
Yeah.
even the peritoneum, that lining in the belly.
Really?
Yeah, and it can be constant pain or it can come and go, but lasting more than, say, 3 days.
Wow. So it's not always the digestive tract. That really broadens the diagnostic puzzle, doesn't it?
It does.
It drives home that figuring out the actual underlying cause can be incredibly tough.
Exactly right. It's rarely simple. It really turns into a whole body detective story.
Right. And now here's where it gets really interesting, I think. The list of potential culprits for this chronic or recurrent colic, it's huge.
It is surprisingly vast, yeah.
We're talking everything from, basic management stuff to really complex diseases, not just the GI tract, but other systems too.
You're absolutely right. The diversity is immense. That's why just treating the symptoms, that one-size-fits-all idea, it just doesn't work here.
Makes sense.
So let's dive into some of the big ones you might run into. First, equine gastric ulcer syndrome, EGUS.
Okay, ulcers. We hear a lot about those.
We do, and for good reason. It's incredibly common. Some studies, up to 90% of racehorses, maybe 60% of performance horses.
90%. Wow, that's staggering.
It really is. It tells you a lot about the pressures these horses are under. It's often linked to acid exposure, stress, even NSAID use pain relievers.
Right.
Signs are usually things like mild recurrent colic. Maybe they go off their feet a bit, lose some weight, or just aren't performing well. Their attitude might change.
That prevalence stat alone is eye-opening. Really makes you think about management, doesn't it?
It absolutely should. Then there's inflammatory bowel disease, or IBD.
Okay.
This is chronic inflammation in the intestinal wall. Often it's the horse's own immune system overreacting. The key thing here, it messes up nutrient absorption,
Yeah.
malabsorption.
Ah, so they're eating but not getting the goodness out of it.
Precisely. So you see recurrent colic, chronic weight loss, sometimes diarrhea, their coat looks dull, maybe even that swelling under the belly ventral edema because they're losing protein.
Gotcha.
Another big one, especially in certain areas, is sand accumulation, sand enteropathy.
Right, from eating off the ground.
Exactly. They ingest sand or dirt, maybe grazing short pastures in sandy areas, or, eating high off the ground.
Yeah.
It builds up in the large colon, irritates the lining.
I've heard places like California, Arizona.
Yeah, Tehachapi in California is a classic example. Sandy soil, the sand just sits there, heavy, abrasive, messes with gut movement. Owners might see colic that comes and goes, maybe diarrhea, weight loss.
Okay. And related to that.
Enteroliths, intestinal stones.
Sounds like you're so whole.
Yep. Mineral concretions. They form and grow right there in the gut,
Hmm.
common where there's lots of alfalfa hay, certain minerals in the water. Think Western USA again.
How big can they get?
Pretty big. They grow slowly, causing maybe mild intermittent colic for a while, like a partial blockage. But then, bam, they can shift and cause a sudden, severe, complete blockage.
Oh, wow.
You'll see recurrent colic, often quite severe, but intermittent. I remember reading about one case, a stone the size of a grapefruit, caused subtle problems for years before the big one.
Grapefruit size. Good grief. They sound like little time bombs ticking away in
They
there.
really can be. Then you have chronic impactions. These are blockages of feed material that keep happening, usually large colon or cecum.
And what causes those typically?
Often simpler things, actually. Dehydration's a big one. Poor teeth if they can't chew properly. Coarse hay or feed. Switching feed too fast. Not enough exercise.
So more management related again?
A lot of the time, yes. Signs are usually mild to moderate recurrent colic, maybe fewer droppings, and the manure looks dry.
Okay. What else is on the list?
Switching gears a bit, larval cyathostomonosis, small strong gnile larvae.
Parasites.
Right. This is quite dramatic. It's when a whole bunch of encysted larvae emerge from the gut wall all at once, causes severe inflammation, protein loss.
And that's linked to deworming.
Often, yes. Inadequate deworming programs, it's a stark reminder of why targeted parasite control is so important. Usually, you see acute bad diarrhea, but it can cause chronic weight loss, poor performance, and intermittent colic, too.
Okay. Keep going. This list is long.
It is. Next up, dorsal colitis, RDC. This is ulceration, inflammation in a specific part of the large colon, the right dorsal colon.
And the cause here.
Here's the critical point.
Right.
It's most often linked to chronic or high-dose use of NSAIDs, things like butphenylbutazone.
So the pain relief can actually cause another problem.
Ironically, yes. That's
Okay.
a huge takeaway. Signs are often recurrent, but maybe mild colic, lethargy, not eating well, weight loss, sometimes diarrhea, maybe that ventral edema again.
Wow. Okay.
And then adhesions. These usually happen after colic surgery.
Scar tissue.
Basically, yes, bands of fibrous tissue that form between organs. They can kink things off, cause partial or intermittent blockages, leads to recurrent colic, could be mild, could be severe, depends where they form.
Makes sense.
And briefly, there are others too, less common maybe, but still important. Things like abnormal motility disorders where the gut just doesn't move right, sometimes linked to stress, neoplasia tumors, ileal hypertrophy, thickening of part of the small intestine muscle.
That covers the gut pretty well. What about outside the GI tract?
Right, those non-gastrointestinal causes.
Mhm.
You've got things like ovarian issues and mares, tumors, infections. Kidney or liver disease can make a horse feel generally unwell, mimicking colic signs. And urolithiasis, bladder stones. They can cause abdominal pain too.
That is a truly comprehensive list. Phew. It makes you realize just how many things could be going on.
Absolutely.
And looking across all those causes, you start to see common risk factors pop up, don't you? Like
Yeah.
previous surgery, diet, obviously, where they live, too many NSAIDs, specific parasites like tapeworms or those cythostomes, not enough water, sudden exercise changes, their deworming history, pregnancy, even just bad teeth.
Exactly. It paints a picture of a multifaceted challenge. It's rarely just one thing in isolation.
So, okay, given this enormous list of possibilities, how does a vet even start to figure it out? What does this mean for actually diagnosing what's wrong?
Yeah.
It sounds like it has to be this really comprehensive, step-by-step process of elimination. You can't just guess.
You absolutely can't guess. You're right. It's a diagnostic journey, like putting together a really complex puzzle. And it almost always starts with a detailed history.
Talking to the owner.
Deeply. Think of us as detectives gathering witness statements. It's so crucial. We need to know the frequency, duration, severity of the colic. How bad is it? What does it look like?
Does it respond to Banamine?
Exactly.
Yeah.
Response to medication, their exact diet, type of hay, grain, supplements, any changes. How are they fed? On the ground in a sandy paddock. Big red flag right there.
Right.
Deworming history, meds, especially NSAIDs. We keep coming back to that dental history. Their daily routines, stress factors, previous surgeries, all vital clues. We often push owners to keep a colic log.
Track every move.
Meticulously, because those patterns, often the most valuable clues we get.
Okay, history first, then what?
Then a thorough physical exam, vitals, hydration, listening carefully to gut sounds. Are they normal, increased, decreased? But critically important here, an oral examination.
Checking the teeth.
Thoroughly, looking for hooks, waves,
Yeah.
sharp points, anything that stops them chewing properly, because that directly impacts digestion
Yeah.
and rectal palpation.
Right, the vet reaching in.
Yep, feeling for impactions, checking if the intestines feel displaced, searching for masses. Sometimes you can literally feel the gradient of sand or the hardness of an enterolith.
Wow.
And we also look for that ventral edema, the swelling underneath. That points towards protein loss, maybe IBD or RDC.
Okay, so physical clues. Then you move to lab tests.
Usually, yes, blood work. A CBC complete blood count can show anemia or signs of inflammation, like high fibrinogen or SAA. Those are proteins that go up with inflammation.
Okay.
Serum biochemistry checks organ function, liver, kidneys, electrolytes, and importantly, albumin and total protein levels. Low levels can scream protein-losing issues, like IBD. A high white blood cell count could mean chronic inflammation, too.
And checking the manure.
Definitely. Fecal diagnostics. A fecal egg count tells us about adult worm burdens.
Great.
The fecal sand test is simple but effective. Mix manure with water in a glove or bag. Let it settle. Sand sinks.
Neat trick.
It works. And if there's diarrhea, maybe fecal PCR or culture to look for bacteria or viruses.
It sounds like there's a lot you can do even before the fancier stuff. For an owner listening, which of these early steps usually gives the biggest clues?
That's a good question. Honestly, that detailed history combined with the physical exam, especially the dental check and the rectal palpation, often gives the most immediate, tangible clues. But then, yes, we often need to go deeper.
With imaging.
Exactly. Abdominal imaging is incredibly powerful. Abdominal ultrasound lets us look at the intestinal walls. Are they thickened, like in IBD or RDC? Is there extra fluid in the belly? Enlarged lymph nodes? Some tumors. You can sometimes even see sand swirling around.
Okay. But you mentioned sand needs something else.
For a really definitive diagnosis of sand, or especially enteroliths, abdominal radiography X-rays is the gold standard.
X-rays of a horse's belly. That sounds...
It requires powerful machines, yeah. Usually only at referral hospitals for adult horses because, well, they're big.
Yeah.
But it gives you a clear picture of stones or sand accumulation.
Got it. What about looking inside with a scope?
Gastroscopy. That's the one. An endoscope goes into the stomach, even the first part of the small intestine. It's the definitive way to diagnose EGUS gastric ulcers. You see them right there.
Makes sense. Are there other tests too?
There are. Sometimes an oral glucose absorption test. It checks how well the small intestine absorbs sugar, which can be poor in conditions like IBD. Abdominocentesis, the belly tap. We take a small sample of the fluid that surrounds the organs in the abdomen. Check it for signs of inflammation, infection, sometimes even cancer cells.
Right.
A rectal biopsy can sometimes point towards IBD, taking a tiny pinch of tissue, but a normal one doesn't completely rule out IBD if the problem's higher up.
Okay. And if you've done all that and you still don't have an answer?
Then you might consider the final step, often the ultimate diagnostic tool, exploratory laparotomy, colic surgery.
Going in surgically.
Exactly. It lets you directly see and feel everything in the abdomen. You can identify adhesions, find masses, see thickened bowel, take full-thickness biopsies for definitive answers. It's both diagnostic and potentially therapeutic right then and there.
But it's major surgery.
Absolutely. It's invasive, it's expensive, it carries risks, anesthesia, infection, more adhesions later. But sometimes it's the only way to get a definitive answer and potentially fix the problem when everything else is inconclusive or the horse is severely affected.
It sounds like a true last resort, but yeah, an incredibly important one for those really puzzling cases. So, okay, once you've gone through that whole journey, potentially even surgery, and you have a cause, what next? How do you turn things around for these horses?
Right.
It sounds like it has to be a mix of treating the specific thing you found plus broader management changes.
That's exactly right. The treatment becomes highly specific.
Yeah.
For EGUS, like we said, omeprazole gastrogard, UlcerGard is the key medication, but it has to be combined with management changes. More forage, less grain, reduced stress.
Okay.
For sand enteropathy, psyllium is often used. You feed it daily for maybe 5-7 days a month. It helps bind the sand and move it out. And crucially, feed off the ground. Use mats or feeders. Surgery if it's really bad.
And the stones, enteroliths.
Surgery is the only way to get them out definitively.
Yeah.
Prognosis is usually good if you catch it before the gut is severely damaged. Prevention, less alfalfa, more grass hay, maybe water adjustments if needed.
What about IBD?
That's tougher. Usually IBD requires corticosteroids like prednisolone or dexamethasone to calm down the immune system. Plus, careful dietary management, highly digestible low allergen feeds.
Okay, and those chronic impactions.
Chronic impactions are often managed medically, first fluids by tube, mineral oil, maybe psyllium. But the long game is prevention. Fix the teeth, ensure constant fresh water, more churn out, more forage, slow feed changes, regular exercise.
Makes sense. RDC, the NSAID colitis.
For RDC, rule number 1, absolutely critical. Stop the NSAIDs completely. Then dietary changes, low bulk, easily digestible feed, maybe sucralfate to help coat and heal the ulcers.
Okay. And the parasite one, larval cythostominosis.
Larval cythostominosis needs specific dewormers that target those insisted stages like moxidectin or a 5-day course of double-dose fenbendazole. Often use steroids, too, to manage the massive inflammation when the larvae die off. And then a solid fecal test-based deworming strategy going forward.
And adhesions.
Adhesions are tricky, sometimes managed medically, but if they're causing clear blockages, surgery to cut them might be needed, though they can reform.
It's really clear how specific the treatment needs to be, but like you said, that's just one piece.
Yeah.
What about the general well-being and prevention for any horse, especially one prone to colic?
Yes.
This seems like the part where the owner's daily routine and consistency become absolutely critical, right? Even after you've treated the specific cause.
You've absolutely hit the nail on the head. These general management and prevention strategies are the foundation. They're crucial for all recurrent colic cases, whatever the cause. And honestly, sometimes, even if we don't find a single definitive cause, optimizing these things makes the biggest difference.
So what are the key points there?
Dietary management is number one.
Yeah.
Forage first, forage foremost. Aim for 1.52% of their body weight in forage daily. Free choice is ideal. Mimics natural grazing. Slow feeders are great.
Minimize the grain.
Absolutely. Minimize concentrates. If you feed grain, small meals frequently, and this is huge, all diet changes must be slow, over 7 to 14 days. No sudden switches.
Core.
Water access, non-negotiable, constant, clean, fresh, palatable water. Use heated buckets in winter. Add salt or electrolytes to encourage drinking if needed.
Exercise.
Exercise and turnout, super important. Maximize turnout time if possible. Movement stimulates gut motility.
Well,
Even a stalled, daily exercise is essential. Keep things moving, literally.
and teeth again.
Dental care, can't stress it enough. Regular checks, once or twice a year, proper floating. If they can't chew well, digestion starts off wrong.
Parasites.
Parasite control, targeted deworming based on fecal egg counts. Work with your vet, avoids resistance, controls the key parasites like small strong siles, and clean up manure regularly.
Stress.
Stress reduction, minimize changes in routine, where they live, who their buddies are, provide companionship. Horses are herd animals.
What about things like probiotics?
Probiotics, prebiotics. They may help support a healthy gut microbiome. The evidence is still evolving, but worth discussing with your vet.
Okay.
And finally, just monitoring. Vigilant owners. Keep that colic log. Track appetite, manure output, water intake, attitude, any subtle signs of discomfort. It helps you and your vets spot trouble early.
Be careful with NSAIDs.
And always use NSAIDs judiciously. Remember that RDC risk. Use the lowest effective dose for the shortest possible time under vet guidance.
Right. So, okay, you've done the diagnostics, treated the cause, put all these management strategies in place. What does the future look like? What's the prognosis for these horses with chronic or recurrent colic? It sounds like it could vary a lot.
It really does vary hugely. Depends heavily on the specific cause and, frankly, on the owner's ability and commitment to that long-term management we just talked about.
So some have a good outlook.
Yes. Many of the management-related causes mild impactions. Maybe some EGUS cases if managed well. Dental problems once fixed, sand colic if addressed. They often carry a good prognosis. With the right changes, these horses can do very well.
Okay.
But not always. Not always. For conditions like severe IVD, significant RDC, or if they have really extensive adhesions from surgery, the prognosis is often more fair to guard it. Meaning they might need ongoing, pretty intensive management for life. Some might never get back to full athletic function. They might still have occasional colic episodes, despite best efforts.
And the poor prognosis cases.
Unfortunately, yes. If the underlying cause is progressive and untreatable, like certain cancers, or really severe chronic gut motility problems that just don't respond to anything, then the prognosis is guarded to poor.
That's tough.
It is. But ultimately, what this all really boils down to is this: a thorough, persistent diagnostic effort combined with a really committed long-term management plan. That's what gives these horses the best chance.
Improves quality of life, reduces the episodes.
Exactly, and it absolutely requires a strong partnership. The owner and the veterinarian have to work closely together, communicate well, navigate all these complexities to give that horse the best possible care.
Wow, what a deep dive that was.
Right.
We've really covered the waterfront here, haven't we? From just defining chronic and recurrent colic through that huge list of causes, the intricate diagnostic steps, and the really comprehensive treatment and management.
Yeah.
It's definitely a complex area of equine health.
Right.
Really highlights the need for persistence from everyone involved.
It really does. And as we wrap up, maybe here's a final thought for you, the listener, to mull over.
Okay.
How might consistently recognizing, maybe even meticulously tracking, those subtle chronic signs of discomfort, not just in horses, but in any animal, how might that transform our whole approach to their long-term health,
Yes, yeah.
moving us beyond just reacting to crises?
Towards truly proactive preventative care.
Exactly. Something to think about.